Good evening. It's my true honor to be able to introduce my friend and classmate, Dr. Park Dietz, the foremost forensic psychiatrist in the United States, who's going to speak to us tonight. Dr. Dietz is the founder and president of Park Dietz and Associates, an interdisciplinary forensic expert firm, and founder and head of Threat Assessment Group, the world's first violence in the workplace prevention company. He previously taught at Harvard Medical School, the University of Virginia Schools of Law and Medicine, and the UCLA David Geffen School of Medicine. He received his education at Cornell, Johns Hopkins, and the University of Pennsylvania. Dr. Dietz is past president of the American Academy of Psychiatry and the Law, a distinguished life fellow of the American Psychiatric Association, and a fellow of the American Academy of Forensic Sciences. In 2009, Science Magazine, Security Magazine, named him one of the top 25 most influential people in the security industry. In 2010, he received the Seymour Pollock Award for distinguished contributions for education in forensic psychiatry. In 2025, he received the Distinguished Alumnus Award from the Johns Hopkins University Alumni Association. He has testified or consulted in all 50 states, and among his cases have been many high-profile criminal cases that involve psychiatric issues, including the attempted assassination of Ronald Reagan and on Congresswoman Gabrielle Giffords, Jeffrey Dahmer, William Bonin, Charles Nigg, Joel Rifkin, Arthur Shawcross, Richard Caputo, Joseph Naso, and more than 20 other serial killers. The Menendez brothers, O.J. Simpson, the abductions of Polly Klaas and Elizabeth Smart, the Unabomber, and the Boston Marathon bombing. He's also consulted on a number of films, including The Bodyguard, Copycat, Kiss the Girls, Primal Fear, Turbulence, and What Lies Beneath. He's also been a consultant for many TV shows, including Law and Order Criminal Intent, and Law and Order Los Angeles. And I'm just going at this point to turn this over to Dr. Dietz, who's going to give us, I think, an extremely interesting talk.
Thank you, Dr. Byeff, for the kind introduction and for all of the work you do on behalf of the Johns Hopkins Medicine Alumni Association. I greatly appreciate the invitation to address the broader Hopkins community and its guests. Facing this illustrious audience, I'm reminded of an occasion when a few members of my med school graduating class were asked to speak to the Hopkins medical alumni on the 25th anniversary of our graduation. That day, my wife Annie attended our talks. My topic was a study I'd conducted with Bruce Harry of 100 serial killers in healthcare, that is, doctors and nurses who'd murdered 3 or more patients, and the steps that medical institutions could take to prevent future cases. As Annie and I listened to the stories of one classmate after another, describing their devotion to the conquest of disease in the third world and the development of new treatments for child leukemia and cancer, Annie whispered in my ear, "You're in trouble." I can imagine her giving me the same warning today, considering the number of Nobel laureates among our fellow alumni. The most common question I'm asked by those who learn of my forensic work is, how did you get interested in such things? I certainly understand the curiosity, as it's an unconventional career path, and today I'm going to share what I hope will be instructive aspects of mine. When I was a child, my father, a general practitioner who'd taken over his own father's medical practice, showed me medical and surgical photos at the dinner table nightly, and he spoke reverently of the great institutions of medicine, specifically Hopkins, Penn, and Harvard, and instilled in me a sense of duty to become a physician. But when I was 16, a girl I knew confided that she had been raped by a local hoodlum, as they used to be called, whom I also knew. Her confusion and pain had a profound effect on me. From that point on, I wanted to understand the extremes of human behavior, especially crime and the human response to trauma. And I had an intuition that understanding crime might be a necessary first step to control crime and reduce the number of people victimized. As a college student, I experienced a dilemma as to whether to study medicine, as my family expected, or to pursue my interest in criminology, which I'd only recently learned was an actual discipline. I traveled to UC Berkeley to learn about its doctoral program in criminology and decided to apply. Back east and working on my application, I happened to see an article in Time magazine reporting that then Governor Reagan was closing the Graduate School of Criminology, apparently because it was the only way he could rid the campus of a tenured professor who was an avowed Marxist. I was still unsure about my future and weighed down by the uncertainty when I stumbled upon a book that would change my life. Perhaps because there was a law school on campus, the Cornell campus store had on its shelves a copy of a book entitled Forensic Medicine by Keith Simpson, professor of forensic medicine at the University of London. I was shocked by the crime scene and autopsy photographs in the book, which were about as ghastly as the average episode of a crime drama on TV today, depicting skeletonized human remains found in a trunk, infants killed by their mothers, a man dressed in women's undergarments hanging in the woods, and wounds inflicted by firearms, knives, razors, hatchets, and more. Judging by the homicides depicted in Simpson's book, it looked as though there was a path to working in both medicine and criminology. 3 years later, during a trip to London as a medical student, Professor Simpson took me to my first homicide scene, to the autopsy room, to the pathology museum at Guy's Hospital, and, it being London, to tea. I was still a medical student when I saw my first psychiatric exam of a murderer. It took place at Western Penitentiary in Pennsylvania in the company of Herb Thomas, a psychoanalyst who edited the recently established journal known then as the Bulletin of the American Academy of Psychiatry and the Law. In 1972, at the fourth annual meeting of the Academy, known as Apple, Herb introduced me to his friends, who were the other leading forensic psychiatrists in the U.S., and he gave me the opportunity to win the favor of leaders in the field by letting me copy edit their manuscripts before publication in the journal, a skill I'd honed as a student editor of the now-defunct Johns Hopkins Medical Journal. I've always imagined that this behind-the-scenes grunt work is why these same people said nice things about me a decade later when federal prosecutors asked around about an expert who could handle the Hinckley case. Throughout my education, I had the great fortune to be allowed to stray across disciplinary boundaries to satisfy my curiosity about a wide range of subjects in the behavioral, biological, and medical sciences. At Hopkins, this was made possible through the MD PhD program in behavioral sciences, in which we were supported to earn doctorates in psychology or sociology, and by the Robert Wood Johnson Foundation Clinical Scholars Program, which encouraged us to earn public health degrees. 12 of us entered the MD PhD program, but one of us was murdered across the street from the hospital, an unwelcome reminder of the need to work on violence prevention. After exposure to all these disciplines, I was drawn especially to forensic psychiatry. In part, it offered a chance to go deeper into criminal behavior and the emotional impact on victims and their families than would be possible in forensic pathology, with its emphasis on dead victims and brief contact with grieving families. More than that, it struck me that forensic psychiatrists were better positioned to figure out how and why crimes occurred and how and why lives were shattered. As I took my place in the field, however, I was puzzled by its continuing emphasis on theory and jurisprudence. It seemed most of the great forensic psychiatrists of the day were well-versed in relevant aspects of law, but were unfamiliar with criminology, the social sciences, or forensic science. Many continued to see their work through the traditional lens of clinical psychiatry. As a student and resident, I roamed among the Johns Hopkins Hospital, the schools of medicine and public health, the Department of Social Relations at Homewood, and the Office of the Chief Medical Examiner of Maryland, where I met Susan Baker, a professor in the School of Hygiene and Public Health as it was then known. Sue was a true pioneer in the then nascent field of injury control research, and she fundamentally altered my thinking. After we'd collaborated on a study of drowning, I proposed to look at homicide, assault, and rape as intentional injuries and to pursue their prevention using the public health tools I was then learning about. She encouraged me to do so and later proposed me for a National Academy of Sciences Committee on Injury Control. In later years, reviewing cases for the FBI Behavioral Science Unit in research or in forensic practice, this early focus on prevention conditioned me to notice details in each crime or trauma that gave me a better understanding of what led up to the incident and highlighted missed opportunities for prevention. In Baltimore, Jonas Rappaport, whom I'd also met through Apple and who introduced Phipps residents to forensic psychiatry, gave me the opportunity to survey members of the Maryland Psychiatric Association for my PhD dissertation, which showed that one could predict what treatment a patient would receive by knowing about the psychiatrist and not about the patient. Jonas continued to mentor me through the remainder of medical school and residency and beyond. As a resident at the Phipps Clinic at Hopkins, I was taught and influenced by Jerome Frank, John Money, Paul McHugh, Philip Slavny, and the ghost of Adolph Meyer, whose life chart was my introduction to the importance of a chronological life history. I went to the University of Pennsylvania for a forensic psychiatry fellowship during my final years as a Robert Wood Johnson Foundation clinical scholar. Along with the other clinical scholars at Penn, I spent time at the Wharton School, where everyone else was earning an MBA. Unlike them, I spent my time hanging out with Marvin Wolfgang and his colleagues at the Criminology Center, also housed at Wharton, and I attended weekly conferences at the Philadelphia Medical Examiner's Office. As was true at Hopkins, I both valued and took advantage of the immense freedom that came from knowing that senior mentors encouraged us to cross disciplinary boundaries and to explore new ways of looking at the world. My first day out of training, I arrived at my new job at Harvard Medical School, reported to my chairman, Sherbert Fraser, and asked what he wanted me to do. He looked over his phone messages, handed me one, and said, "Go over to this company and figure out what to do with an employee who just threatened to kill his boss." I stumbled my way through that one, and fortunately, no one was hurt. But it occurred to me that someone ought to figure out a good way to deal with this sort of threat. This planted the seed for a major portion of my life's work. On the second day, I was sent off to Bridgewater State Hospital for the criminally insane, an infamous snake pit that achieved notoriety during the trial of the Boston Strangler and a documentary film entitled Tittycut Follies, depicting the abuse of patients and named after the address of the hospital on Tittycut Road. My assignment was to transform it into a Harvard teaching hospital, and this one wasn't quite as easy as the previous day's workplace threat. Nonetheless, newly minted and no doubt idealistic, I plunged in. Observing early on that both patients and staff were frequently getting injured, I set about studying how that happened. It turned out that most injuries occurred due to poor technique and subduing violent patients, and I confidently presented my findings to the superintendent, only to be surprised at his cool response. The following week, correctional officers whom he'd alerted took me aside to explain that their injuries were an excuse to stay home to watch playoffs or to go fishing. It was a perk. They let me know that if I interfered with that system, nobody would come to my rescue if I got into a jam with an inmate. I realized I'd have to wait to find an organization better motivated to reduce casualties. I did, however, publish a series of studies of assaults and batteries in forensic facilities. While working at Bridgewater with no outside phone line and no secretarial support, I served as program chairman for Apple, organizing it from my apartment. This was before there was fierce competition for program slots, and I invited presentations from the FBI Behavioral Science Unit, as a result of which I got to know Bob Ressler, Roy Hazelwood, and John Douglas, three of the pioneers in the field of criminal profiling, now known as criminal behavior investigative analysis. These and other FBI agents became significant colleagues and collaborators ever since, and a dozen former federal agents are on our company roster today. One of the few private assignments I had time to pursue during my time at Harvard is a favorite example of how we never know where the work we do will take us. A lawyer representing accused serial killer Richard Cunningham, known as the Times Square Slasher, asked me to establish how commonly handcuffs and adhesive tape were being used in sexual acts between adults in Manhattan and Bergen County, New Jersey. Evidence of these paraphernalia at multiple crime scenes was being used to link the homicides with which the defendant had been charged. A grand budget of $10,000 was available for research to try to answer this referral question. Undaunted, a research assistant and I flew to New York and set to work. We tried to interview prostitutes who advertised in the Village Voice, but they wouldn't talk to us. We interviewed the proprietors of bondage supply stores about their sales. We observed the prop tables and audience requests at a bondage theater. We selected a random sample of adults-only bookstores in the Times Square neighborhood and classified the images on the covers of magazines. We compiled these offbeat data, reported our findings to the client, and submitted the quantitative part of the study for publication. I assumed at the time that was the end of it. As it turned out, those trips in and out of Times Square bookstores and sex shops would lead to unexpected opportunities. At this time, I was publishing a lot about sex offenses and sexual deviations, and someone with considerable influence called me in to chastise me for working on such dirty topics, which were seen as unsuitable for an assistant professor at Harvard. I was still working at Bridgewater when John Hinckley shot President Reagan, Jim Brady, and others. Imagine my surprise at age 32 to get a call from Roger Edelman, the federal prosecutor assigned the case, asking me to be in charge of the evaluation. Looking back, I remain immensely grateful for that call. Even more, I'm grateful for what he taught me in the year that followed. Then an assistant U.S. attorney with experience trying insanity cases, Roger taught me what a sophisticated consumer of forensic psychiatric services wanted to see in an expert evaluation of insanity. He encouraged me to form a team of experts, which included Jonas Rappaport, Jim Kavanaugh, Richard Rogers, and John Monahan, all prominent figures at the time. Roger also supported our reading every scrap of paper, visiting the crime scene and the places Hinckley had lived and stayed, examining the physical evidence, conducting multiple interviews of Hinckley, and interviewing both those who knew him well and all of the proximal witnesses. This was a new approach to evaluating criminal responsibility. As far as I can tell, the only case in which anyone had ever done anything half as thorough was in the evaluation of Leopold and Loeb in 1924, when Clarence Darrow, after first trying to retain Sigmund Freud, who declined the case, turned to the best alienists in the U.S. to evaluate the boys. Because Darrow withdrew the plea of insanity, the scope of that evaluation was never made public, and I learned of it only through a copy of the report that found its way into the collection of my friend Michael Baden. And 1 year, I went from doing hour-long superficial evaluations of criminal responsibility to what might be the first ever 1,000-hour evaluation. More importantly, the thoroughness of this approach made it possible to apply the pre-incident, incident, and post-incident analysis common in injury control research to a complete set of data about this offender and his crime. The multiple opportunities to prevent the crime became apparent from the data we'd gathered, and these findings had implications beyond the individual case. From then on, in every case, I've tried to apply the evaluative technique I'd learned in the Hinckley case, and in turn taught my trainees and colleagues to do the same, at times calling this approach medical criminology or investigative forensic psychiatry, neither of which terms really caught on with anyone other than a dear colleague, Stephen Pitt, who was murdered by a man unhappy with Dr. Pitt's evaluation of him in a child custody dispute. The technique of investigative evaluations proved very effective in getting closer to the truth and made me more valuable to the lawyers on the right side of the case and more problematic to the lawyers on, well, the other side of the case. After the Hinckley case, I found myself recruited by various universities and was torn between an appointment in criminology at the University of California, Irvine, where I'd fallen in love with Southern California beach communities, and an appointment in law and psychiatry at the University of Virginia, which offered double the salary and half the cost of housing. I chose Virginia, where I had what I think was the best law and psychiatry job in the country, as it was a hard money job and truly half-time in both schools. Teaching law students, forensic psychiatry fellows, and students of many disciplines who came to the forensic psychiatry clinic to observe evaluations or came from throughout the state for mandatory forensic training. My predecessor at Virginia, Browning Hoffman, had set up an examination room at the clinic with video recording equipment and a two-way mirror so that students could watch examinations. Watching videos of my own examinations, I was surprised to find mistakes I was making, such as asking leading or suggestive questions or talking too much. I asked my students to catch me making such mistakes so I could unlearn what I believe are bad habits taught in busy clinical practice, particularly in the emergency room setting. Since discovering the value of videotaped exams in 1982, I've sought to videotape every forensic examination. Criminal defense attorneys often refuse to allow this, whichever side I'm working for, and with the issues litigated, the results are inconsistent. Nonetheless, I believe videotape exams are the gold standard for preserving behavioral evidence and maximizing transparency. When I make a mistake in an exam, it should be captured for all to see, as the quest should be to get as close to the truth as we can with complete documentation of our methods. Some of my colleagues argue that videotaping won't work for paranoid evaluees, but my experience contradicts this. For example, when William Tager, who killed a stagehand outside the Today Show when he was gunning for Katie Couric and Bryant Gumbel because he thought they were surveilling him in his home, entered the exam room and saw the camera, he thanked me for being the first person honest enough to show him the camera. The preventive ideas that emerged from the Hinckley case became the basis of a grant proposal to the National Institute of Justice that supported years of research on threats and attacks against public figures. It led in turn to training for the Intelligence Division of the Secret Service, the Capitol Police, and the Threat Management Unit of LAPD, and to helping to establish a threat management unit for the CIA. It led also to my working in an advisory capacity to the food processing and pharmaceutical industries as they scrambled to manage the fallout from an epidemic of tampering crimes following the 1982 Tylenol case that peaked at 3,500 incidents in 1986. By the way, I believe the Tylenol murders have now been solved by Tim Cooper, an Idaho cold case investigator whom I had the privilege to help, though the killer won't be publicly identified until a forthcoming episode of Unsolved Mysteries has aired, with the funds donated to the victim families. Finally, this line of work led to my founding Threat Assessment Group in 1987 to help large organizations respond to the high costs of violence, crimes, and other misconduct in the workplace, in colleges, and in schools. The point I want to make about all of this is that in applying the tools of injury control research in my forensic psychiatry practice, I was following through on Sue Baker's early encouragement. I was also finding that Sue had taught me that following the data led in sometimes unexpected directions. In the meantime, that little study of Times Square pornography had been published in the American Journal of Psychiatry. Psychology Today ran a blurb on it, probably because the topic was titillating, and it led to a call from a congressional staffer inviting me to brief members of Congress on the state of pornography in America. I went to the Hill, made my presentation, and in concluding, offered to show the members of Congress samples from my briefcase. They nervously declined. Following my visit to Congress, I received a call from the White House, still occupied by President Reagan, regarding possible service on a new commission on pornography. These conversations were underway when I made a fairly public mistake. An abstract about the work on pornography that I'd submitted for the 1984 meeting of the Clinical Scholars Alumni was accepted, and I showed what I thought were some mild examples in my slides. It turned out a number of non-physician board members had brought their wives to the meeting, and someone complained that my slides were obscene. It took me completely by surprise, as one of my main points was to warn people about what their children were being exposed to as a major source of sex education in America. At the same time, it was an important lesson in how difficult public conversation about sex can be. I was given a thorough word lashing by the organizers. Apparently, none of them called the White House because I was appointed a commissioner by the Attorney General of the United States, and a dozen of us traveled around the U.S. holding public hearings in federal buildings. While the pornography did all in its power to ridicule the commission as a bunch of prudes, I took a narrow public health approach to the issue. I emphasized the abuse of the persons who were used in production, the injurious products promoted by the industry, the collateral damage caused by urban vice districts, the dissemination of sexual information, and so on. I was declared a genius in forensic psychiatry by Playboy. So far, that's the only publication to call me this. I still find it amusing that at the same time that church groups were distributing 100,000 copies of my personal statement from the commission report, Bob Guccione invited me to be his house guest for a year to write a book while getting to know the Penthouse Pets of the Month, an offer I politely declined and reported. Then I repeated the same mistake I'd made at the Clinical Scholars Reunion. I was giving a talk on sexually sadistic criminals to the Royal College of Psychiatrists and the Institute of Psychiatry in London, and showed a few slides of some of the pornography the offenders in my study had in their possession. This time around, though, I thought I was addressing psychiatrists who evaluated criminals. I felt a responsibility to demonstrate to these physicians the true nature of sadistic pornography and not tiptoe around it. Frankly, I can't recall any course I've ever taken in medicine where the clinical details of the subject, however grisly, were left to the imagination. I think you know where I'm going with this. The slides created an absolute furor. One person even warned me that I could be arrested simply for possessing such material in England. Now you know why I'm not showing slides today. My experience in London can be traced perhaps in part to the gap I'd seen early on between a more traditional clinical psychiatry and what I believed forensic psychiatry might be. A comparison of the approach of a clinical psychiatrist with that of a forensic psychiatrist illustrates what I see as the corrosive effects of the traditional clinical role. Differences include helping the patient versus helping find the truth, reliance on information the patient volunteers versus skepticism toward all parties to the dispute, evidence filtered through impressionistic, inferential, and interpolated reasoning versus active participation in an investigation to unearth relevant data. I see it as the role of a forensic psychiatrist to suggest avenues of investigation, to review all of the evidence, to ensure that all the necessary testing is done. Our role is to reach for as objective an understanding of what actually happened as possible. Perhaps there's a risk to following evidence wherever it leads. The results may be uncomfortable or even upsetting. They may go against closely held beliefs, and they may not be what the retaining attorney hopes to hear. But forensic psychiatry isn't simply about opinions. It's about trying to find, analyze, and present the evidence as clearly as possible. It's this commitment to following the facts wherever they lead, I think, that has led me to some unexpected places. A Soldier of Fortune convention in the late 80s, when the magazine was still publishing hitman ads in its classified, and then again after I'd testified against them and was subjected to threats and intimidation. West German Chancellor Helmut Kohl's hunting lodge, meeting with Nobel laureates who thought I was idiotic for suggesting that embryonic stem cell research might meet political resistance when it became known in the US. Ted Kaczynski's cabin, where the FBI politely declined my request to spend the night. Flying over armed skinheads in the FBI's hostage rescue team helicopter to land on an Idaho mountaintop known as Ruby Ridge. The homes of Hollywood celebrities frightened by stalkers or wanting coaching for a role. A gay bar where Jeffrey Dahmer cruised for victims. A jail interview room with Night Stalker Richard Ramirez, the only defendant I've left shackled during an interview in 47 years. An FBI command center in Waco listening to hostage negotiators and David Koresh. A police helicopter flying with Elizabeth Smart to find a crime scene before snowfall covered the landscape's identifying features. Backstage with Carlos Santana and Annie when the New Mexico State Police were about to cancel the concert until the event promoter hyped me to the commander, who allowed me to investigate the bomb threat and determine it wasn't legitimate. A federal lockup in Manhattan, where I spent New Year's Eve with the so-called cannibal cop. Another federal lockup in Brooklyn, where R. Kelly serenaded Renee Sorrentino and me during a sentencing evaluation. I've been led to some unexpected conclusions in my work. In our early research on inappropriate communications to members of Congress, we found that love letters, requests for help, and demands for change were more dangerous than death threats. My work providing training and behavioral consultation to prevent violence has found applicability in the prevention of violence in a great many settings. Much more unexpectedly, it's extended to incivility and disruptive behaviors generally, the sort of misbehavior that may not appear as a threat, but that nevertheless works as a drag on productivity and morale. I've learned that the tools most commonly used by employment lawyers to try to help their clients avoid violence usually make a bad situation worse. Restraining orders, calling the police about threatened violence, and walking out threatening employees to make an example of them. All three of these tend to make matters worse, like poking a wild animal with a sharp stick. and each has been the cause of more than one of the mass murders you've read about in the headlines. I've learned that seemingly nice, shy people can do terrible things. Like Dylan Roof, Jeffrey Dahmer, and at least 3 other serial killers out of the 25 or so I've examined were gentle, sweet men when they weren't killing. I could go on, but you get the idea. I left the full-time academic world and a professorship at Virginia nearly 40 years ago to move to Southern California. And there I've grown my forensic practice, eventually incorporating it, grew threat assessment group, and joined the volunteer faculty at UCLA. Ever since the Hinckley case, I've routinely sought collaboration across disciplines. This has not always been well received by psychiatric colleagues who sometimes express narrow guild issues. But in countless cases, I've assembled interdisciplinary teams of experts to address complex cases. Guidance, instruction, and opportunities arise from this interdisciplinary work, and we all learn from one another. I'll mention a couple recent examples. In U.S. v. Robert Brockman, the largest tax evasion case in U.S. history, there was a dispute as to the defendant's degree of cognitive impairment, and the issue was whether he was competent to stand trial. Our team consisted of a behavioral neurologist, a forensic neuropsychologist, and me. We conferred with one another by telephone on several occasions to plan logistics, share ideas on additional investigation, testing, interviews, or studies, and to compare observations. All 3 of us testified, and he was found competent to stand trial. Similarly, in U.S. v. Robert Bowers, the worst anti-Semitic attack in U.S. history, our team included a behavioral neurologist, forensic neuropsychologist, neuroscientist, former FBI polygraph examiner, and me. 4 of us wrote independent reports and sat in court for the defense expert testimony, and 2 of us testified in rebuttal. As sometimes happens, opposing counsel sought to portray our teamwork as a nefarious conspiracy, but the court and the jury saw through that argument. It helps not to get defensive about such nonsense. High-profile cases carry risks and rewards. My involvement has brought me a few stalkers, threats, autograph requests, surveillance by an investigator from opposing counsel, both good and bad press, and an abundance of media requests. My work takes me unexpectedly back again and again to the events that led up to violence, crime, or traumatic events that often play out over an extended period of time. Violence never erupts without warning, but the warnings are often seen by various people who don't communicate with one another, who don't recognize them, or who don't know what to do about it. I'm especially interested in finding new ways to capture the observations of the many people who come in contact with the perpetrator along the way and the opportunities they have, and they're always there, for seeing what might be coming and for taking steps to prevent it. In fact, we've developed an app for use in workplaces and other large organizations, allowing people to report and centralize their observations. It's called Say Something. In cases like the Columbine killers, Klebold and Harris, and Gabby Gifford's attacker, Jared Loughner, there was no shortage of signs of trouble, but the most definitive warning signs to be found in their personal writings, video recordings, and weapons could only have been discovered by attentive family members willing to search the rooms of young people in trouble. In thousands of cases, we've helped everyone stay safe by treating threatening and dangerous employees better than their managers think they deserve, by not contesting unemployment, by continuing health insurance during a family member's illness or pregnancy, and by other kind acts that cost our clients less than would armed guards or surveillance teams. Remarkably, sometimes all that's needed to stay safe and avoid sparking violence is to behave like a decent human being.
Thank you, Dr. Dietz. We have a number of questions here in order. Heather asked, how do you see project management practices working in the field of security risk consulting industry within the higher education, K through 12, and healthcare space pertaining to active threat assailants on campus?
Well, first of all, corporations have an easier job at preventing violence than do any campus institutions, whether schools or colleges. And that's because corporations can determine who enters, they can fire people, they can keep them out under various kinds of leave, they can prevent their reentry, and they can lock their doors. Schools of all kinds have a problem doing that. Often public law prevents them from locking people out. Often they have to accept people who are unsuitable to be in that environment because it's required under the law to provide education. And often they have overly elaborate bureaucracies designed to try to deal with with the bad behavior that is reported. So it's very difficult in those contexts. In fact, after doing training for a number of school districts and states, um, we determined that it really wasn't going to become institutionalized in a way we could support. And we since limited our work to working with corporations who follow good advice and try to keep everybody safe. The emergence of threat assessment teams, as they're too often called, has had some successes at preventing violent incidents. And of course, that's to be applauded. But there are difficulties with the usual machines that have been set up to do that. They often lack the resources needed to intervene in the ways that would truly be helpful. And that is a matter very much of the budgets, particularly for public schools.
We have several other questions. Excuse me. Renata asked, which serial killer in the U.S. history do you consider the most dangerous or brutal, and why? Is there one whose crimes left the strongest negative impression on you?
Interesting question that I haven't been asked before. I have to say, I am so non-judgmental in my interviews, which is one of the tools that helps me get more honest answers from interviewees, that I never think of them as evil, though of course many of them are, nor do I compare them with respect to how bad their behavior is. All of them have committed ghastly, terrible crimes, and I don't know that we ought to pick one as the worst.
Thank you. Cindy noted, your career began during what seemed to be a real peak in serial killing in the U.S. Do you think there were more people with serial murder potential back then, or are there just as many now, but we're just better at intervening before it gets to that? She also notes, of course, I'm sure your work has played a role in that decrease.
Well, I wish, but I think nobody knows. I think it would be speculation to try to say whether it's increased, decreased, or changed at all. Um, Part of what makes it so difficult to know is that the investigation of homicide varies from jurisdiction to jurisdiction, and over time, very large numbers of homicide cases are never solved, and that number has risen dramatically in recent decades. So we don't even know how many murder victims there truly are. We don't know who did a large proportion of the murders. And so there's no good way to count serial killers.
On a similar note, Henry asked, what do you make of the recent boom in serial killer media? Why do you think it's captured the zeitgeist? And have you noticed trends of interest like this in at other times in your career?
Yes, it is very much the fodder for television, films, books. It was only, I think, 40 years ago that on my behalf, someone tried to sell serial killer stories to Hollywood, and they all said nobody'd be interested in that. And now it seems you can hardly find a show on TV that isn't about serial murder. The same thing happened, um, and this is an illustrative story, I think. When I was studying what amounts to stalking behaviors, before that word had been introduced to mean the pursuit of an unwanted relationship, I had countless media interviews, and reporters would not believe that this was a problem for anyone other than a handful of celebrities to be stalked. Well, the study we had done showed that at one time, some celebrities, A-listers, had as many as 20,000 pursuers. So this is not a rare occurrence. More importantly, perhaps, uh, there are countless domestic violence victims who are pursued by their exes in very dangerous ways. And they don't have the resources to guard against this. But I could not persuade journalists this was a social problem of magnitude. Only after the murder of Rebecca Schaefer by Robert Bardo, and every congressman passed a law as an anti-stalking bill, did it catch the public's attention. And suddenly, every TV show and movie had a stalking theme. And every teenager knew the word stalking. It happened overnight. And this has been true of a great many social problems that suddenly come to light. They've been there all along, but they're not in the public consciousness.
We have several more questions. Barbara asked, as true crime has become so popular and more amateurs engage in analyzing cases, have you ever received information or insight from a non-professional that helped advance your work?
I'm afraid not. Um, there have been people who've sent boxes of documents, but I don't have time to read boxes of documents when it's not a case I'm retained on and know where it's going. So there could be something of value in there, but I haven't seen it.
So we have one, Mark had two questions. What do you feel has been the pinnacle of your career? And where do you think the field of forensic psychiatry is heading in the future? He says, thank you so much for gracing us with your time and experience.
In many ways, it was a pinnacle of my career to receive the Distinguished Alumnus Award. It was very satisfying to me, and I felt so honored to receive it. Another pinnacle, I'd have to say, is having testified in the Robert Bowers trial. That seemed like such a significant case in an era in which anti-Semitism is returning. Um, I think the future of forensic psychiatry requires that level-headed people avoid the errors that AI will introduce into the field, and that over-reliance on AI is the biggest threat to objective, thorough investigative work. It can be helpful, but it has to be kept on a leash.
David just said a question which I think is interesting. He has done a forensic pathology rotation in medical school. He has thought about the field a lot over the years. He asked, do you have an recommendation for current texts in forensic psychiatry or pathology? He also said, thank you for your contribution and commitment to this field. Can you explain your psychological tools that allow you to maintain balance in the face of such human depravity?
I'd have to say, with respect to book recommendations, that I would recommend the same thing I did during medical school, which is buy the three leading textbooks, read them all, and whatever shows up in all three is the most important information.
And he also said, can you explain your psychological tools that allow you to maintain balance in the face of such human depravity, which I think must be something that you deal with on a constant basis.
Yet I never have a clever answer for this. What I think is that having done it so much, having immersed myself so deeply in all of this, I've developed not calluses, but the same kind of distance that allows a surgeon to cut into a human body. We have to think of the people we are evaluating or treating in a different way than one thinks about one's family and friends and neighbors. We each have our own technique for how to do that. But for me, the most helpful thing is trying to see the world from the point of view of that person and to not judge them for what they've done. My job usually is to see whether they meet certain legal criteria. And that's an academic, intellectual task that doesn't require making any judgments about good or evil.
Great. I think, unfortunately, we've exhausted our time. And I think everyone on this call would like to thank Dr. Dietz greatly for sharing his insights and for giving us a tremendously interesting presentation about something we don't usually hear about.
Thank you.
So I think on that, we will end the call, but thank you again.
My pleasure.